In the last video, what we talked about was the effect of joint trauma on your stability of your joint. We're going to go into that in a little bit more detail, but I'm going to talk a little bit about the consequences of not having a stable joint. So last time, just as a quick review, we talked about how when you have a very, very fast stretch of a muscle that's supporting the joint, it's going to have an effect on the length of that muscle. So we actually have this mechanism with the load sensor in the muscle between two different types of sensors in the muscles around the joint. So you have very deep muscles called intrinsic muscles, and they have two types of sensors like other muscles. They have what are called the muscle spindle, which senses the rate of change. We have the muscle Golgi tendon organ, which also senses a load on the muscle. Now, one of the things that happens when we have this joint trauma is our body isn't really making a mistake there, because if we only relied on the muscle spindle, say for instance, if we were to fall from a height, if we only had the muscle spindle, what would happen is we would hit the ground and we'd stimulate the muscle spindle, which in turn would make the muscle contract. Now, if you were to fall with a strong enough force, or have a strong enough force happening anywhere in any joint in your body, and you were to have that happen, the muscles are so powerful that they would actually damage the muscle or damage the joint. So there is actually a very real reason why we have that Golgi tendon organ, to reset the tone or the length of that muscle. So it's there for a reason. It's not some mistake from the creator. It's actually there to protect us and protect our longevity. It's better to have a muscle that's a little bit long than to have a joint that's completely ruined. So there is a purpose for the Golgi tendon organ, and that's primarily what it is. But like I said before, we can use that mechanism with a very, very fast and deliberate stretch to make some muscles longer. So if we have muscles that are too tight, we can very effectively lengthen those muscles through this resetting of the gain mechanism. So in other words, if we stretch a joint through a certain range of motion at a very, very high velocity, we will bias the position sensors, these Golgi tendon organs, and that will reset the gain of those muscles and give us more movement in that vector where it was restricted. So one of the things I want to talk about first is what happens when your joint is compromised like that. So when we have a trauma that's caused some joint instability, what's happening is the muscles might be too tight on one side and too loose on another side, or too long on the other side. So when you move in one direction, it would move too much and be unstable, and you move in the other direction and there'd be some resistance. Now the resistance is actually the resistance going back towards a neutral position. So this is something that's very, very important, because if there's tension and resistance going back to neutral, then what that means is you can't actually achieve that neutral position in your joint. And that could be a big problem for several reasons. One is, when you're in the neutral position, that's when there's the least stress on the joint. So if the muscles are balanced around the joint and they're giving good stability, then that's actually the least stressful position. Everything away from that has more stress in it. The other thing that's complicating that, as I mentioned in the last video, is if you have this muscle imbalance, your body doesn't like having the instability on one side, so what it's going to do is increase the tone of extrinsic muscles, which again are primarily designed to move you to the side, but combined with an imbalance of the stabilizing muscles, what it's going to do is move the joint in kind of a strange position and put more load on the joint, but it's not going to allow the joint to come closer to neutral. You're going to sort of go around to neutral, but you're going to be in some other weird position, and you're going to adopt a strange motion, which we call pathomechanics. Pathomechanics isn't good. Not being able to be neutral isn't good. Again, first reason, more stress on the joint. There's too much tension in the wrong places and not enough in the right places to allow you to achieve that neutral position. Another component is, so first again, stress, and the first one was stress. So if we can't get to that position, there's going to be more stress in the joint. And the second component, as I was saying before, as well just now, is that it can't achieve stability. So if you don't have stability, it's going to allow this joint to move in a pathomechanical way, and again, that's going to add to more stress over time, and that's when we start to see problems with inflammations around the joints. We see disc problems, we see all of the long-term effects of joint pathomechanics come as a result, again, of not being able to achieve that neutral position. So all of this is really, really important. Now, a third component, so stress and stability, those are the first two. The third is that in the neutral position, that's where our body really wants to be, and there's a really high concentration of receptors. Your body is trying to stay as close to neutral as possible. There really isn't any good reason for your body staying with the joint way off to the side. If we can stay in the neutral position, we're going to be able to have a greater longevity. We're going to be able to have less stress on the joint, and but also because there's more receptors around that joint, and there's more receptors there because we have to be highly refined in how we respond to gravity. So this brings in another concept, is that gravity is always pulling us one way or the other. So what's actually happening if we watch ourselves in slow motion, kind of microscopically, we'd see that we're all sort of oscillating. So as we wobble from sort of a neutral or a position-ish position to one side, what's going to happen is our body's going to sense that motion and contract muscles appropriate to bring us back to a neutral position. And our body is trying to do that as quickly as possible with as least amplitude possible. So if the body is functioning at a very, very high level, because we're always oscillating, we see that the oscillation is so fast and so small that we don't actually see it. When there's a pathology, what happens is the amplitude increases, so you see people starting to wobble, okay? People start to wobble, and so the amplitude increases, okay, and it slows down. So we see a higher amplitude and a slower frequency. Okay, one is a high frequency and a very, very small amplitude. So in order to achieve a high frequency and a low amplitude, what our body has to be able to do is to be able to sense at the smallest motion to the side and to be able to respond very, very quickly. Now, to lay this back into what we were talking about the joint trauma, is that when that joint is in a position where it isn't achieving its neutral position, it's not stable for one. There's going to be a lot of pressure in the pathomechanics, so we're not getting a good sense of where that joint is. So all of these joints in your neck, especially because there's a lot of sensors in your neck, are giving information to your brain to tell you where you are and how you're moving in relation to gravity. Now, if you were to imagine that, say you have 4 joints in your neck that are pathomechanical, what is the effect of that going to be on your brain's perception of where gravity is taking you? It's going to decrease your brain's awareness of how you're moving. So it's going to decrease the effectiveness of coming back to neutral. So as soon as you start to move off to one side, your body is going to want to bring yourself back, but if it doesn't have enough information telling you which way you're going or how much you're going, then what's going to have to happen is you're going to have to increase the amplitude of motion. So you're going to have to move more before you can sense that, and then you're going to have to hope that these muscles are appropriately activated enough to be able to bring you back. So this is really a very, very key issue, and a lot of us in practice, we have people standing on soft cushions to sort of see how they wobble and have them put their feet together and close their eyes and all these other tricks you see doctors doing. Really what that's telling us is we're trying to figure out how much you oscillate and in which vectors you oscillate. Because if you have a lot of joints that are compromised in one vector of motion, we're going to see that your oscillation is going to be in that same motion. In other words, where your joint is compromised, that vector of motion is going to represent itself in an increased amplitude of your oscillation in that same vector, because you don't have as much information coming along that vector of motion where the joint trauma was. So this is a way that we use our diagnostic tools to figure out what vector we need to try to fix. And there's lots and lots of different tools we can use to do this. But primarily what we're doing is trying to, again, figure out this vector and to find the way to increase your ability to return to neutral with the least amount of resistance. So again, if the joint is in this position and there is muscle tension that's creating resistance to come back to neutral, wouldn't it make the most sense to resolve that tension so that your joint can easily come back to neutral? And if we adjust the joint in a way where we adjust it and finish at a neutral position, then we're much more likely to create a balance of these intrinsic muscles and then create joint stability. So this is one of the things I've been working on a lot for the last couple of years, is trying to modify some of the techniques we use. There's lots of different chiropractic techniques. And so I've worked with two or three different techniques and managed to modify those techniques so that rather than moving the joint past neutral and stretching it at the end range of the motion, we're able to stretch that joint and finish it in a neutral position. It sounds a little bit strange, but it is something that's entirely possible, and it's what I'm finding in doing this is that we can actually create more stability in the joint immediately. So this is very interesting because once you have a joint which is stable, then we know there's less stress in the joint. We're going to have faster healing if there's any irritated tissues around there, and we're also going to have greater reception. So there's less stress. It's more stable, and we're going to have more activation of those receptors, which means we're going to be able to sense those perturbations, those movements around neutral, and our joint will actually be able to achieve neutral, not only at one joint, but in all of those joints. So again, maybe we had 4 joints in the neck that weren't able to achieve a neutral position, and then we can resolve those tensions, then that's going to have a very big effect on your ability to stabilize the joint. So how do we fix that? I hate to leave you with a cliffhanger, but there's lots and lots of ways I think that we can fix that. Chiropractic, as I just said, is one way, but for sure that's not the only way. I've figured out lots of different ways that we can do this. There's lots of different tools that we have as neurologists that allow us to stimulate the nervous system in a way. But what I will say is that it appears that from my opinion, I have to separate out what's fact and opinion. So everything I've said so far is fact, my opinion, and what my findings are suggesting are that if we can focus on position sensor activation, that will allow us to recalibrate those tensions around the muscles in a way that's going to create a longer term change. So to answer the question briefly, yes, we can fix it. Yes, there's lots and lots of ways that we can, and I want to try to give people sort of, general audience viewers some ideas of how we can do that as well. And I think there are a lot of things that you can do yourself. I don't think you need to necessarily rely on someone else to give you those answers or to give you a treatment necessarily. I think there's lots of things we can do that are going to help to balance the system out. I look forward to telling you more about that in future videos, but I hope you find this interesting, and if you like it, give me a thumbs up, subscribe, and I'll try to keep putting more and more videos up. And if you have any comments, please put your comments in and I'll try to answer any questions you have. Okay, thanks for watching.